Hi everyone, this is Ramya from TechEduMaster near 𝗲𝗂𝗧𝗲 Medical College, 𝗂𝗯-𝗧𝗲. So today I'm here to give some information regarding the speaking subtest of OET. So in OET speaking, you know that it is the nurse who will be starting the role play. So once you started the role play or once you introduce yourself, the next step is gathering information. And the third step is giving information. So you know how to gather information. You know what are the type of questions, like open-ended and close-ended questions can be asked in order to get information from the patient. So what are the ways which you can provide information? This is the topic which I'm going to cover in this video. Okay, so before you give information, it is necessary to understand what the patient actually know about this condition or the procedure or about the medicine. Okay, have you heard about warfarin? Do you have any idea regarding that? So you can ask them in order to get information regarding what are their knowledge about this particular thing. Okay, later another thing, when you are explaining about this procedure or about the medicine or about the dosage or whatever it is, you need to do pauses. Okay, you cannot do it as a monologue. You cannot start it and you have to it should not go in such a way that there is no pauses. It won't be that good to hear. Okay, another thing is that like once in a while you need to check the understanding of the patient, whether the patient understand about these things. Okay, and the last thing what you have to take care is that you need to discover the information that the patient needs. Okay, you need to understand what are the concerns of the patient, which are the area which requires more clarification. So you need to get an idea about regarding that also. Okay, so now let's see in detail. So how to discover the patient's information needs? How you can discover the information that the patient needs? Okay, so for that, how you can ask questions? You can just ask like, can you tell me what you know about the procedure, or have you heard about warfarin? Okay, or is there anything else that you would like to ask me? So once you have already explained about a procedure, you can ask him like whether he requires more clarification about that. Is there something which you would like to ask me? Okay, or else you can just ask like, do you have any other questions regarding the same? Okay, in this way you can make the patient or you can understand that whether the other person understand what you were saying. Okay, another thing is like you need to use pauses. Okay, if you are saying a procedure, if you are explaining a procedure continuously without any pauses, I don't think that it is really very good to hear. It's always better you need to say that in a particular tone. You have to maintain your tone and intonations while you are speaking. Then only that will be good to hear. Okay, so for that, what you have to do, you have to pause it once in a while. It's not like after every sentence you need to pause. You can pause once in a while. For example, if you are explaining about the use of an inhaler, how you can say that one? Yeah, well, I'm going to explain and show you how to use an inhaler. But first, I would like to talk about what causes asthma. Is that all right? Okay, so that is a pause. Next, you can start like, so asthma is caused by an inflammation of the airways and it can be triggered by many things. One common trigger is allergies, or perhaps environmental factors such as smoke, pollution or cold air. Another trigger could be exercise, or asthma might also be set off by colds or flu. I hope it's clear. Okay, that is another pause. Again, you can continue with your speaking. So this means it is important to identify and then avoid your asthma triggers to keep the condition under control. All right, do you have any question about that? So that means you have already explained about the inhaler usage and the problems, the triggering factors caused by this asthma. Okay, so and you at last you are asking like, do you have any other questions regarding the same? So if the patient did not understand anything related to the explanation, he will be getting a chance to ask that one. So that is why we are requesting you to pause once in a while. So the next thing what you have to take care when you are providing information or when you are giving information is that you have to encourage the reactions and feelings of the patient. How? You can just understand like, I do understand how difficult it is to make these changes. Okay, if you want to advise him to make some changes in his daily routines of his dietary pattern, you can ask like, I do understand how difficult it is to make changes, but you know, you can make it gradually. If you are taking alcohol like 4 to 5 units a day, you can gradually decrease it. Okay, so that way only you can say, or else like you have to stop it. You cannot say like that. Okay, it's always better to advise them, request them. Okay, another way is like having a fear of needles is really very common. Okay, and I often see how distressing it can be. However, this injection is this vaccination is quite important. This vaccination should be taken before the travel. Okay, and it is really vital to have a booster dose. Like when you are speaking about a vaccination, you can just tell him that this is like a very small ant bite. Okay, this is not going to hurt you. Okay, and this is really very necessary if you are traveling to so and so countries. Okay, in that way you can encourage the reactions and feelings. You are considering the feelings of other person or the patient. That will really help you in your speaking. Okay, another thing is that you need to check the understanding of the patient, whether the patient really understand what you are saying. That is also quite important. For that, what you have to do, you have to ask them whether they really understand what you are saying. So okay, so we have talked about how to apply a dressing. Could you talk me through the steps again? Could you really do you really understand how the procedure has to be done? Or else you can just ask like, you can just explain the procedure and just ask him whether do you think that you can manage it? Okay, so you have to explain it and you need to ask him whether they can manage it by themselves. Or else you can just ask him like, is there anything that you would like me to go over again if you want? Like that means you are telling the patient that you are ready to explain it again and again if the patient doesn't understand it. That will also really helps the patient and that will also really increase your score. Okay, so I hope that is also clear. So these are the way in which you have to provide information. So now let me tell you some tips. Okay, tips that will help you to provide when you are providing information. The first thing is that you should never rush through the task. You should not go in a very speed or very fast way. You have to pause it. You should be a very good listener and don't rush through the role play card and don't forget about the interculator. You should not forget about the interculator. It's like a 2:3 ratio. 2 minutes will be for the interculator and 3 minutes for you, the patient. For you, the nurse. Okay, so you should never forget to give time for the other person to speak. Next thing is that you have to find the opportunities during your preparation time. You should use your preparation time wisely. Then only you will be able to take over the play in a very good manner. And the last one is that you need to check whether the patient really understand what you are saying, whether they can follow what you are saying. Okay, so if you can follow these methods, I think you can just you can easily provide information to the patient, and that will really help you to get a good score in your OIT speaking. So I hope the video is clear. Thank you. Take care.